Good morning, folks. Daviess County Judge Executive Al Mattingly here, and we're going to get into a Zoom meeting with two good and old friends. When I say old, it's not OLD, it's OLE. Clay Horton from the Greenford District Health Department and Dr. DuFrayne from Owensboro Health. Welcome, gentlemen.
Thank you. Thank you for having us.
Nice to have you. And as we were talking earlier, it's nice that I haven't seen you in a while. Not that we haven't had issues and don't continue to have issues with COVID in our community, but it seems that our community has been doing a lot of the things that we want them to do. We just wish they would do more of it, don't we, Clay?
I think that's a good way to put it, Judge.
Before we get started, Jordan, can you throw up that first picture on the screen? And we want to talk a little bit about what's going on. And so if you look at this, I think, Clay, this was the latest update that you gave us for October 15th through the 18th. We had 123 new cases in Daviess County. That's for the 15th, 16th, 17th, I think. 55.5% of our population has been vaccinated. That's our population, but that includes people who are not eligible for vaccination, anyone under the age of 12. And I don't like that one in particular. I think, Clay, we're probably in the range of 66, 67% of those who are eligible or who are 18 and above. I think that 18 to 12 is kind of in limbo. The good news is that over 87% of our seniors in Daviess County have been vaccinated. Look at the number of confirmed cases, 16,416. We have about 103,000 people in Daviess County. What that means is 16% of the people in this county have had COVID. Our incident rate now today is at 34.4. That is down. And we're going to bring another picture up, but the 34.4 is down from, I believe, a high of 82 back just 4 or 5 weeks ago. 256 deaths, way too many deaths. That's 256 folks in Daviess County that won't be around to celebrate the holidays with their friends and families and pass on all that wisdom that they gained. But also understand that some of those deaths have been in their 20s, 30s, and 40s. So, in a lot of the cases, and we'll get into that, a lot of the cases have been in younger folks, where that first go around about this time last year was mainly in senior populations. Show me the next one, Jordan. And I'm not going to steal Dr. DuFrayne's thunder, but this is a daily report that I get. If you look, we have 16 people in critical care. 13 of those are unvaccinated. 1 is fully vaccinated, and that means that there are 2 in there who probably have a partial vaccination. 42 total hospitalized. 29 are fully vaccinated, or 9 are fully vaccinated. 29 are unvaccinated. That probably, again, means that the difference are people who had maybe 1 shot. Intubation is something we don't want anybody to go through. 1 person who's fully vaccinated is there. 10 of the 11 are unvaccinated. So let's go to the next one. This shows you the current incident rate map. So this is current as of 10/19 yesterday afternoon. You'll notice the state incident rate is 30.25. If you look at Daviess County, we're on this one, we're now at 31.7. Some of our sister counties have dropped in orange, which means they are less than 25 cases per 100,000. And some of our counties are now in yellow. It's always good to see those in yellow. I'm waiting to see my first green county, but those are less than 10 cases per 100,000. One other slide I think you have. No, COVID incident rates. September the 7th, we hit a high of 81.62 cases per 100,000. In July of this year, we were at 33, and look all the way back to June 25th, we were at 1.69. So in July and August, essentially 2 months, we went from having 1.69 cases per day in Daviess County to 81.62. And I think Dr. DuFrayne would agree that just is an indication of how infectious the Delta variant is. Now you can see the decline as we slide back down. Didn't take long to climb up, but it's going to take a heck of a lot longer to get back to that 1.69. Jordan, thanks. Hop off. And we're gonna open this up for some conversation. So, hey, tell me, what's the current outlook for Daviess County as well as the Commonwealth for COVID?
Well, locally, Judge, I think you did a really good job of kind of summing up where we've been over the last 3 months. The trends are about the same for the state as a whole, and really for the country. And even if you look internationally, the global COVID-19 rates are down. They're up a little bit the last couple of weeks in Europe, which is a little concerning. But overall, I would say for Daviess County, Kentucky, the United States, all trends are moving in a positive direction. Our case rates are down. Our positivity percentages for total number of tests is continuing to decline. I think last night Kentucky reported being under 7%, and that's the first time we've been under 7% for the last 3 months. And so things are looking good. Hospitalizations are down. I'm sure Dr. DuFrayne is seeing that in terms of their workload and their type. Mortality, unfortunately, are still kind of plateaued, but we expect that. We expect the mortalities to kind of trail the hospitalization data. So we're heading in a better direction. We're hopeful. But our basic messages and our advice to folks are the same, is that we're still seeing a very high incident rate of COVID-19 in our community, not as high as it was, but it's still important to take steps to protect yourself. And the number one thing folks can do is to get vaccinated if you're not vaccinated already. And masks continue to be an effective way to slow the spread of COVID-19, especially when you're in public spaces and around crowds. So we want to encourage people to continue to do those things. Healthcare institutions, public places, or places that you still should be wearing masks, or schools. Masking is still important, but our best tool, the off-ramp to getting out of this pandemic is getting as many people vaccinated as possible.
Okay. Clay, you make a good point about masking. My wife and I continue to wear a mask when we go out in public. Often we're the only ones that wear those masks into a restaurant. Last night we went out with a group to eat. We walked into the restaurant and people looked at us like we had worms coming out of our ears. That's okay. It didn't bother me because so far, knock on wood, I haven't had COVID. And yes, I am vaccinated, and we anticipate getting as we talked about with Dr. DuFrayne earlier, we anticipate getting our booster as soon as it becomes available. Dr. DuFrayne, tell me the outlook for the hospital. Back, gosh, a month and a half ago, 45 days ago, we were concerned that we were going to overflow, that there would be rooms that we wouldn't have enough of anything and everything to treat people. Tell me what's going on there.
So just to give you a little background, and you're right. So in September into early October, we peaked at 69 active COVID patients in the hospital. That was the highest number we've ever had throughout the pandemic. And as you could well imagine, a staff that was already pretty much stressed and trying to recuperate from the first wave of COVID, all of a sudden this came along, and it's really had an effect. It's had an effect on our staff, and they're holding in, they're holding up and they're doing well, but you can just see it. Mm-hmm. We got to the point where not that we couldn't take COVID patients and other patients, but we had a good number of our beds that were unstaffed. So we just had open beds and we couldn't admit patients to them. And that was really the trend all over the country. So today we've had a peak of 69. Today we're at 39. That's 39. So it's an improvement. And it's always relative to where you've come from. So coming from 69, that's great. Right. But there are still 39 patients in the hospital who are pretty sick.
Yeah.
So that's the state of affairs.
One of the things I continue to hear from my friends who probably are watching this today and don't believe that we have issues and problems
Mhm.
is that, well, you know, a lot of those patients in Daviess County Hospital are being counted as Daviess County cases and Daviess County deaths when they're from other counties. And number one, that speaks to the regionalism of our hospital, right? I mean,
Yes.
we're happy that we are of sufficient size to be able to transfer folks in, but that's not the case, right? We distinguish between those Daviess County patients and those Daviess County deaths, so we don't pile them on one place or the other.
And that is correct. So that counts for the hospital in the total number of deaths that we've experienced here. But that death goes back to whatever county that person resided. And I have the daily COVID report in front of me. So right now we have patients admitted to the hospital, 39 patients from 10 different counties.
Right.
Only, let me see, Daviess is the highest, obviously at 18. But we have a number of other counties that have 2, 3, and 4 patients. So it is throughout the region. We are a regional medical center, as you were saying, and we want to take care of the people in our area, but it doesn't confuse our statistics.
Okay. And you know, it's funny when you were talking about you had beds that were empty because you didn't have the staff. I go into restaurants every day, tables are empty because they don't have the employees. The
Right.
hospital is no different than these other organizations in looking for folks to, and Clay, the other, you know, I think we do a very good job, the state does and the local health department in researching and making sure, I continue to go back to that. Oh yeah. John motorcycle rider was killed and they counted him as a COVID death because he had COVID. That's not how that works.
It's not, and I think that's one of the,
No.
you know, that's one of the big misinformation, or actually, I'll just say it's a lie. It's one of the things that the lies that we see repeated on social media over and over, and it's just to detract and to discourage folks. You know, nobody's ready for this to be over any more than the folks that are working in the health department and the hospital and healthcare, you know, and government for that matter. I mean, we're schools, everybody is done with this, or certainly would want to be. But no, the reporting, you know, even here locally, before we report out a COVID death, we have an epidemiologist that reviews the criteria to make sure that it's, you know, that COVID's a cause of death. And then before it's reported out the state, there's a mortality committee that reviews every case to verify that you know is being attributed correctly. So this notion that anyone who dies is being attributed as a COVID death is just out and out wrong. It's not correct at all.
Okay. Have you guys, both of you, Clay, I'll come to you. Have you seen an uptick in vaccinations as a result of this latest increase in COVID, the plateau?
We did. So, you know, we look at our case rates in our area, you know, we started kind of escalating at the end of July, and through August and September, we did see an increase of those that are coming, getting vaccinated. We also saw a little bit of a jump up in total vaccines administered into September and early October, when third doses became available for those that were moderately to severely immunocompromised, and then Pfizer boosters became available after that. So it looks like that has gone down some through the latter part of October. But initially we did, and it's interesting, you know, we do a lot of different clinics, a lot of different settings for COVID vaccines at the health department, and some of the staff will, during the period of time where they're doing their observation, after you get your shot, to make sure that no one has an adverse reaction, they'll have conversations. And we're hearing cited a lot that people making that decision to get vaccinated because somebody that they know or somebody they were close to, ended up in the hospital, or a family member died. And it's really unfortunate and sad, but I think sometimes it takes those things that happens, to us personally, or things that we can feel in our own lives to make people make those decisions. So, that's the unfortunate part of having to go through this experience is, we saw a lot of cases, we saw a lot of suffering, but that in turn caused more people to make positive steps in their own lives to take care of themselves and take care of their family.
Okay. You know, Dr. Frayne, I'm going to say something here is probably going to be long-winded, and then I'm going to ask you to comment, so get ready. I think the evidence proves that the vaccine is very effective, whether it be Johnson & Johnson, Pfizer, Moderna. I know somewhere I read a statistic that said 95% of the deaths that have occurred since July 1 were in unvaccinated people. Then you'll go on Facebook and see somebody say, yeah, but why should I get the vaccine if 5% of those people died? I have an opportunity to die anyway. So instead of talking in terms of 95% of those people are protected, they fixate on the negative side, or the ones who passed away. And I have no data to back this up, but I would say those that pass away, even though they're vaccinated, typically are those who are older patients or immunocompromised.
Yes.
What do you think?
And I would agree with that. And we do have data to back that up, here at the hospital. So to me, a perfect example is Colin Powell, who passed away, who was COVID vaccinated and died from COVID. However, he was also actively undergoing cancer treatment, and he was immunocompromised. And that's what we also observe. So the number of COVID patients who have been vaccinated, who have died here, have a high rate of comorbidities, diabetes, high blood pressure, obesity, lung disease. All those things really weaken our systems. So yes, those are the vast majority of patients who have had COVID vaccine who have died. But let's look at it the opposite. Look at all the patients with all of those conditions who have been COVID vaccinated, and they're not in the hospital. They're actually doing great. So a very small percentage. And let's focus on all the good that the vaccine has done. 95% of our, not about 90% of our deaths here are in the unvaccinated now.
I know one of the best examples that I know a household, two folks in the household, one vaccinated, one not, both came down with COVID. The one who was vaccinated said that they had symptoms of a bad cold for 2 or 3 days. The other one was in the hospital for quite some time, and it was really dicey as to whether that person was coming out of the hospital or not.
Yes.
So
And we're tracking even in our employees, how many are COVID positive. When they come in with any symptoms, we test. The vast majority of those patients, either the team members were either not vaccinated, and that's their choice, or the ones who are vaccinated really report exactly what you said. Oh, I felt like I had a little bit of cold for about 2 days. And then I was better. We still keep them out for the, recommended isolation quarantine period. But yes, their symptoms are really mild.
Tell just for folks who are on here, when we talk about immunocompromised, what do we mean? What does that mean?
So we all have an immune system that from the time we're born starts to develop a defense system against any type of infection. So frequently, if you're exposed to something, some type of virus or bacteria, typically more a virus, you'll develop an immune response, so that the next time your body sees that virus, they'll say, oh, already saw that virus, we have defense against it, and you don't even know that you were exposed a second time. So that is our immune system. But then there are some people who are born with some genetically predisposed immune system issues, or people who are on steroids, prednisone or other types of steroids that weakens your immune system. People are on some other medications that we now treat conditions like Crohn's disease or rheumatologic diseases that can weaken their immune system. Every one of those people I tell, absolutely get your vaccine. And then people undergoing chemotherapy, people undergoing cancer treatment. The cancer treatment purposely weakens your immune system, so we can then use the chemotherapy to go after the cancer. So, but those people are immunocompromised. Their immune system is weak.
So when we talk about at the very beginning of the explanation, your body becomes infected, it memorizes that infecting agent, and next time it can respond a lot quicker. That's what we do with vaccines, right? We
Correct.
mimic the infection,
Yes.
but we mimic the infection with a non-lethal portion
Yes.
of the virus. And that's why it's so important to get vaccinated, and those particularly who are immunocompromised, why it's important to have that vaccination. All right, Clay, we keep hearing about booster shots. Pfizer, you can already get a booster shot depending on your age and whether you're immunocompromised or not. I had Moderna, my wife had Moderna. We're awaiting. What is your understanding regarding boosters and the availability of boosters in J&J and Moderna here in the future?
Yeah, so I think that we're looking at a really short time frame in terms of boosters being available for any, regardless of which vaccine that you received initially. I mean, and we'll, I chuckled yesterday. The FDA had a press conference as they were making the recommendations on J&J and Moderna, and the Dr. Marks with the FDA made the comment, it's not simple, but it's not, utterly hopelessly complex either, or confusing either. But there is a lot of confusion with boosters. You think it's confusing for the public, you ought to try to implement a program and try to roll this out. So nobody feels that more than our folks here at the health department or in our pharmacies and other providers. So currently, those that are immunocompromised, either moderately or severely immunocompromised, like Dr. DuFrayne just described, are eligible for a third dose. That's been the case for a number of weeks. Pfizer is already available for those that are at higher risk of infection. So people who are older, people who have certain underlying medical conditions, and those definitions are pretty broad. People that are overweight and obese, people that have diabetes, all are eligible, or people that are likely to come in contact with the public or have jobs that place them at higher risk. People who work in retail, those type of things are eligible for Pfizer boosters. We anticipate that probably before the end of the week that the same will be true for Moderna, and then boosters will be available for anyone who received the J&J, the Johnson & Johnson vaccine at least 2 months ago. The questions that we're waiting on as CDC's advisory committee meets today is, what are the guidelines going to be in terms of these boosters? If they follow the FDA's lead in their announcement yesterday, the patient will have the choice of whichever booster they want to take, regardless of what they received their first dose. So that information should be out very soon. We know it's a little confusing. We know it's not always the straight line. The details are important, but if you have questions, talk to a pharmacist, talk to your healthcare provider, or talk to us here at the health department, because we're certainly staying on top of it.
I just got a message from Jordan. He says that we're having a little bit of connectivity problem, so we may go down, but he's going to record it. So if we go down, hang around. All right, Dr. DuFrayne, put your Karnak hat on.
Okay.
And I want you to be a seer into the future.
Okay.
Are we going to have boosters or shots for COVID from now on? Is this going to be an ongoing thing?
It's not going to surprise me if that actually comes out to be the recommendation, and time will tell us that. They'll do some studies where we measure antibody levels to see if you really start to lose your peak antibody level once you've had a shot or a booster. So time will tell. We'll know in the next year or two, but it's not going to surprise me. Just like a flu shot, if you need a regular or routine, and we haven't defined that period yet, but are you going to need a yearly COVID booster? You may. They may just combine it with our flu shot vaccine and get them both at the same time.
Well, by the way, let's address that conspiracy theory out there. We saw where some pharmacy had mistakenly given COVID shots when they were supposed to be giving boosters, and that's the government's way of getting all of us to take those COVID shots against our will. Is that correct? Don't you think? Do you really think that happened?
No.
Quit chuckling. Well, you brought up the flu, and that is funny because I've heard some people say I've received a COVID shot, and that means I don't have to get the flu shot.
Not true. So COVID protects you against COVID, just like the flu shot protects you against flu, and measles protects you against measles. So they are very specific to the virus that we're trying to be protected against.
Okay.
So
Flu, is it transmitted like COVID? Is it pretty much, it's a virus, it's transmitted through the air?
yep, it's called a respiratory or airborne virus, and you get it exactly the same way that you get COVID. So
I noticed last year we didn't have a lot of flu in the community. You know, normally you'll hear people talk, man, I had the flu and I had to go to bed for a week, and but we didn't have a lot. And the reports I get from you guys right now, the last one I looked at closely said that we had 5 incidents of flu from July 1. Of course, the summer for flu is not a big season, but right now you should start to see it pick up.
yes.
Do you think we're going to have a super flu season now because we missed the season?
So that's what the predictions are, that there's real concerns that the flu may be worse this year because we really missed it last year, and we really did miss it. You know, we can have 100+ admissions a year for bad flu cases. Last year, we had 1 during the flu season. And that to me is a testament that just like for COVID, which is an airborne virus, the mask, the social distancing, and the hand washing really protected us from the flu.
Right.
So we're anticipating flu here, and we moved up our time frame for giving flu shots. We're actively giving them now, and everyone at Owensboro Health who will take a flu shot, and for us it's 95% or greater every year, take their flu shot by October 31st. Everybody will have it.
The Judy and I had our flu shot a couple of weeks ago. Now, being one of those people in that class that Clay is always disparaging,
Right.
being an older citizen, we had what we call the old people's dose, but it's actually a little different than the normal dose given. Why do they do that for seniors and not young people? Are you there?
You asking me or Clay?
Yeah, either one of you. Why? I'll ask you, Dr. DuFrayne.
Okay.
And then I've got some other things for Clay. So why do seniors receive a different dose?
So
I think we're there. Go ahead.
yeah. So frequently, one, you've already been exposed to a lot of things, so you don't need as much of an exposure now to the vaccine. So they do give a less of a dose. Clay, you want to have anything to add to that?
Yeah, they offer a high dose for those
Yes.
that are less likely to have a strong immune response, and so there are, you know, there's a number of different manufacturers for flu vaccine, but you know, here at the health department we offer both the quadrivalent standard dose and then the high dose for those that
High
are
dose.
And I think Clay, the answer is as you age, your immune response wanes. I mean, it gets less robust, and that's why we see kids a lot of times are not having the same infection rate as adults would, because for whatever reason, the kids have pretty robust immune system. So that was leading up to the next question. Clay, can kids get a flu shot?
Yeah, so there's flu vaccines available for anyone over the age of 6 months old.
Okay.
So there's, you know,
And I'm assuming if that's the case, then it's recommended that they would get it.
Yeah, that's correct. So, you know, for flu, your populations that are at highest risk are very young children, pregnant women, people that are older, and anyone that has a chronic health condition, you know, things like heart disease, diabetes, asthma, those types of things are at a greater risk of flu. And so those folks should certainly seek out a flu shot. but we recommend it to everyone. And there's lots of opportunities to get flu shots. You can walk into any retail pharmacy and get one. You can get one while you're at your doctor's office. You can, I saw where Owensboro Health did a drive-through flu clinic. A lot of employers offer on-site flu clinics. So seek it out. They're out there. They're easy to get, and it's time. So October is the best time to get your flu shot.
Okay, back when we started dealing with COVID, I think the wisdom was do not get a COVID vaccine when within a week or two of other vaccines like a flu shot. Is that still the case? Should you still wait, or can you go through and get jabbed in both arms and be done with it?
Yeah,
Dr.
so
DuFrayne,
you're
or
right.
both?
Yeah. Initially, you're right. So I mean, we didn't have a lot of data on the COVID vaccine when it first came out, and so they were asking people to take a 14-day break between vaccinations. Hundreds of millions of doses later, they understand a little bit more, and so there's no longer a contraindication for vaccines at the same time. So if you've been vaccinated for COVID and you're going in for your flu shot and you want to get your booster, you can do it right there at the same time. And then through the initial phases of COVID, when people were staying at home, we saw a lot of kids fall behind on their childhood immunizations. So it's fine to get when we have pediatric vaccines coming out in the next couple of weeks, as if you're in for your routine childhood vaccines, it's a good time to go ahead and get a COVID shot and a flu shot. There's no reason to delay on those.
You bring that up, Clay, and it brings up an interesting point. I was very pleased when our Daviess County Public Schools, Owensboro Independent Schools, and the Catholic school system in Daviess County decided to require masking. I've seen other school systems that did not. They made it optional, and they seem to have had to shut down for a while or send lots of people home. Can you give me any sense of how that masking policy has worked in our schools? Have we seen it, fewer kids with COVID, fewer transmissions at school that could be traced at school or to school?
Right. So I mean, we've seems like we've been kind of on a roller coaster with masking with K through 12 institutions. We had we've had with Delta, Delta kind of corresponded with the start of school. But right now, when you look at where the risks are, you look at the types of interactions that you have in school buildings, universal masking is without question the best way to go. And our school systems here have done that. Most of the school systems in Kentucky eventually got there. We had a few that started with mask optional policies. They saw very quickly, especially in August, that was not a good plan. It's not manageable. It was very difficult, and you had a lot of people become infected. You had a lot of quarantines, a lot of exposures that way. One of the things that I'm concerned about, though, is as we see these case rates go down, that people will become impatient, and I think we need to continue to listen to experts. CDC is still highly recommending, or their advice, their good advice is that for K through 12 settings that everyone continue to wear masks. I think you may see that revised as the risk becomes less and it becomes more practical. I think that CDC has kind of shown with time that they do a good job with their recommendations in terms of balancing those risks and based on the best available science at that moment. But I hope that we don't become impatient. I hope we don't jump too soon. But masking continues to be our second best strategy at preventing COVID-19 and the spread in our community, with vaccinations being first. And until we get enough people vaccinated and those incident rates in our community are lower, it's still important.
Okay. Dr. DuFrayne, and we're coming up close to 45 minutes. It's amazing how time flies. Clay brings up a good point, and I hear lots of people say, I've had COVID, I don't need the shot. What do you say to that?
So we are still recommending, whether you've had COVID or not, that you should still get the vaccine. So just like the vaccine is not 100% protective, and no vaccines really are, neither is having a COVID infection. You can still get COVID again. And it tends to be milder at times, but it can be severe. So the vaccine just gives you that added protection. So yes, even though you've had it, you should get the vaccine.
Okay. I guess the last question that I'm gonna have before we close is one of the problems that we see out on Facebook, the conspiracies, is that, well, they told us to do this in February or March of 2000, and then in the middle of the year, they told us to do something else, which was exactly the opposite. And now they're telling us to do something else. Why do they change their minds on this stuff so often?
So
Clay,
a lot of
you're
it,
agreeing?
yeah,
Okay,
so,
go ahead. Yeah.
And they're right, we are getting different recommendations at different times, but really for the first time in our history, we're doing this in real time. So if you look at, so I lived through the beginning of the HIV epidemic and was really heavily involved in treating patients. And it took us 10, 15 years to get a treatment. So now in COVID, in less than a year, we had a vaccine up and running and ready to go. And so, yes, we're all humans and we were dealing in real time and we're looking at data, and sometimes the data is not as complete as you would like it to be. So you're looking at the data early to get people the most protection you can get. You are going to have these kind of times where you say, okay, we're getting a better grasp on what's going on. We're seeing the big picture better. So let's tweak our recommendations. So this whole process to me has actually, as a physician, as a scientist, this has been a phenomenal time.
Yeah.
So, as quickly as we moved from the very beginning until now has been remarkable.
Well, I've always said, I hate the fact that here in the last years on earth, my wife and I are having to go through a pandemic, but we're going through it at probably one of the best times you can, as my grandfather and grandmother went through the 1918 flu pandemic, and there were no treatments, there was no vaccine. And I actually lost my grandmother on my dad's side and an aunt on my dad's side from the 1918 flu pandemic. I remember the HIV in the 80s when it became a scourge, and how slowly and how we prayed that something be done. And to think about it, we were talking in December of 2019 about COVID. And here in December of 2021, we're talking about virtually inoculating the entire populations that want to be inoculated. Clay, here we go. We have Halloween coming up, then Thanksgiving, then Christmas and New Year's. Tell me your recommendations for people.
Well, I mean, I think we're getting back into broken record territory. My recommendation is get vaccinated. Everybody get vaccinated. I think, we went through this last year and we had to make very difficult recommendations to try to limit those gatherings. I don't think the guidance this year is the same. I think, we have tools available to us that we didn't have this time last year. So Halloween, keep it outside, keep it safe. Everyone who's eligible to get vaccinated, please do. If you're going to be in crowded settings, wear a mask. All of the same things that we've been saying over and over, but the factors have changed. I like the way Dr. DuFrayne responded to your last question. I was on a call last week and Dr. Connie White's a deputy commissioner for Department for Public Health. Someone asked her a very similar question. And she said, do you question your stockbroker when he changes his advice from 1 month to the next? The market conditions change. So, what the stockbroker is recommending to you in terms of your investments change. This is the same thing. The recommendations change on what we know and change based on what's happening in the community and what we're seeing this virus do. So to circle back to your question for the holidays coming up, get vaccinated. If you're sick, you're not feeling well, stay away from other people. If you think you've been exposed to COVID-19, get tested. But I think our families can get back together this year as long as everybody's, doing what they need to do, get vaccinated, take care of yourselves between now and then.
Okay. Gentlemen, Clay Horton from the Green River District Health Department, Dr. DuFrayne from Owensboro Health, thank you for being on. I hope the folks who were were watching, learned something new today. I really would like us to get together again, hopefully for the last time. But what I'd like to do is a look back over the last 2 years about what we did right and what we did wrong and what we learned about communicating to people the importance of protecting their health and their family's health. So until that time, be safe, my friends, and everybody get out and get a vaccination. See you guys.
Thank you, Judge.